Well, I just want to welcome everyone that is here today. We have many people online that are joining us remotely. This is as Dave said, our first annual Redefining Chiari Scientific Update, and I am Chanda Meehan, the project manager for the Chiari program here at Washington University. In just a minute, we'll hear a little bit more about our research. Before we dive into that, this is a little bit about our program here. The Park-Reeves and Syringomyelia Research Consortium was established in 2011 as a small data repository with partnering institutions. Over the past 24 years, it has exploded and become one of the largest and most refined cohorts of Chiari type 1 patients in the world. We are taking advantage of artificial intelligence for predictive modeling and changing the way surgery is being done through evidence-based research. Currently, as Dr. Limbrick so well demonstrated, the narrow definition of Chiari malformation makes it very difficult for customized treatment. Through our research and education programs, we're hoping to change how diagnoses are made and how care is delivered. We are incorporating not only the clinical aspects of what physicians are seeing, but a comprehensive and holistic approach to developing new treatment pathways and technologies. We are analyzing genetics, using state-of-the-art radiographic imaging techniques, and patient-reported experiences to reimagine the way we care for patients with Chiari. Without our almost 50 participating centers and our relationships with our family support groups, we wouldn't be where we are today. So we want to extend some gratitude to all of you, and especially our participants. We could not have made the progress without all of you supporting us and trusting us with your information. Because of you, we have published 39 publications and growing. We have 48 collaborating centers. We have over $12 million in grant funding, and we are continuing to make progress on our research. Okay. So whether you have Chiari type 1 with syringomyelia or without, or whether you had a speech disorder or not, we are asking individuals with Chiari to fill out this survey for a potential collaboration with Karen Chanowski at NGH, who is looking to see if there is a relationship between Chiari type 1 and speech disorders. This 5-minute survey will help us build evidence to support our grant application. And then finally, if you would like to learn more about our research and our projects that are going on, please visit us at our website at chiari.wistl.edu. So not too long ago, as Dr. Limbrick mentioned, we were awarded a significant program project grant, which is allowing us to leverage that powerhouse of Washington University and 6 different departments. The program is headed by Dr. Limbrick, who is the chair of the Department of Neurosurgery at Virginia Commonwealth University, and also Chen Yang Liu, the director of AI Health here at Washington University. Dr. Limbrick has been passionate about Chiari research since 2010 when he founded the Park-Reeves Consortium, and Dr. Liu is leading the charge to bridge our comprehensive data set with his expertise in artificial intelligence.
Great. You know, I want to tell you the story of the speech thing. We really want people to sort of take advantage of that, and I'll tell you why. When I first started the Park-Reeves and sort of investigating this line of thinking, I was asked to give a talk to a room of about 75 people through, again, our partnership with Bobby Jones through CSF. And so we sat around the room, and, you know, what happens sometimes at the end is people have questions. So I gave my talk, and then people asked questions. And one person kind of raised their hand and said, you know, my child has this itch they can't scratch. do you think that's related to the Chiari malformation? And I said, no, not related. But I said, well, we're in this room. There's 75 other people. Let's see. Who has ever felt like they have an itch that can't be scratched? And about half the room raised their hand. So it was really a lesson to me that I've got a lot to learn, as much as we think as providers and scientists that we know what's going on. Very often that we really need to hear from patients. And so the most recent example of this is around speech. And I see Dr. Rowland here in the second row. He also has been touched by this, where now that we're sort of thinking about it, we're seeing more and more people that have suffered from speech problems of various sorts. And we're understanding that maybe there's a relationship between childhood apraxia of speech or other kinds of speech apraxia with Chiari malformation through Karen Chernosky at MGH, that's in Boston. We're looking into that. So thanks in advance for considering to participate in that. So we're going to get to our various other experts here, but just to kind of lay the groundwork. So we're going to hear first from Project One, and that the leader of that is Gabe Haller, who's here in the back row. He's going to talk to us about the genetic underpinnings of Chiari malformation and some of the work that he's done there. And then next, Dr. Rowland will talk about the second project in this program, Project Red, which is around the relationship of Chiari and related conditions to how brain networks function. Third, Dr. Straley is going to talk to us about fluid movement and tissue strain and other dynamic factors and how it affects brain development and head brain injury. And then lastly, Dr. Liu, Jinyang Liu, is going to talk to us a little bit about the work that we've been doing and using machine learning and other advanced techniques to look for patterns in the data that we wouldn't otherwise be able to see. So thanks very much. And we're going to switch over to some of these individual presentations.